So, Brother Ali, in our previous video, you told us how Zakat Kenya does the empowerment projects. Is this the only thing that Zakat Kenya uses the Zakat for?
The second category that we work with is the medical.
Medical.
We have a third one, which is the education, and we have a kitty for welfare.
Okay. So there's 4?
There is 4, yes.
Okay.
The emergencies we work with when it happens, we raise some funds and, talk to the public. They will just come and assist. This is the emergency kitty, whereby whenever there's a fire or anything happens, we've been also to distribute it. But that is something whenever it happens.
Tell me about the medical.
Medical, our policy as is for emergency cases, we try as much as possible to disburse the fund within 24 hours.
24 hours.
And for other cases, at least within 72 hours. Sometimes it's a challenge to do that because you need to do some follow-ups. What we try to do as much as possible is to spend less so we can help more people. Sometimes a case comes to us whereby maybe they're asking for a sum of money. We need some time to consult because we have some doctors or institutions that we work with closely. So we've dealt a case whereby someone is being asked to pay 250,000.
Yeah.
We sort it out by 15,000 shillings.
Can you give us a bit more details on this one? So what happens? How do they bring the case to you?
Unfortunately, what I've seen in the medical fraternity, there's a lot of exploitation.
Okay.
A lot of exploitation. That is why we basically work, we commit more when a patient is being seen in a public hospital, because the assumption is this person is poor, cannot afford. But we have situations where families make decisions on where to treat their people. So they go to private facilities. We don't say they should not do that, no. We say it is their patient, it is their family, they do what they want. But we disburse more on public hospitals than in private hospitals. We have limitations for private hospitals to a certain level. Then the public hospitals we disburse more because we feel like someone who goes to public hospital is someone who is very poor.
Okay.
So within 72 hours, because we have cases that,
So these cases, do they still come from the people on the ground or the family contacts you? How?
There is an online application.
Okay.
But mostly whenever they come, we again refer them back. They need to come with a letter from the imam to just confirm, because zakat is an amana. Sadaqa is a bit flexible, but zakat is an amana which has to go to categorize people. So we need to we go extra mile to make sure that whoever we are assisting is someone who deserves to get the zakat. That is why we work closely with people who are on the ground, because they are to give us the heads up that this is a case like this. We let a case, education case which came to us. Someone came to us, they're saying, and this person is crying and saying, my daughter, my son. Then when we follow up on the case, this person has plots. He's taking anachukua rent, like why?
So give me the example of the medical, where you said there was a case, someone came and they quoted 250, but it was...
Yeah, you know what they do? They send us. Whenever they make the applications, they upload the cost. That's a condition. So when it is sent to us, we take it, we send it somewhere else for verification. How is this case? Someone sent me photos and they sent us someone whose foot has been torn. They're being told to pay 150,000. It's an emergency case which needs to go to the theater immediately. So they send us this request. I forwarded it to, I don't want to mention names, but to a doctor who tells me, it's a small case. So let them go to my clinic.
Yeah.
They'll be dressed. Let them come tomorrow for the operation. Tomorrow he paid how much? 12,000. And this person went home.
For the empowerment.
Before we also engage in medical cases, we first try to see how best can we assist this and advise this person. You are being asked to pay this much money here, but you have a doctor who's going to waive his fees, a hospital which is going to waive this and this. It will cost you much less. So what do you think? So they say, okay, I'll go with this. So you tell the doctor, please assist this, then we'll make the payment. Alhamdulillah, some facilities, they even take patients without even us paying a penny. Tell them, say, dear, then we'll sort it out later. So they help these cases.
So in the case of a situation where it's an emergency medical issues, someone they're contacting you, I have a problem, the hospital has told me this much money I need to be treated. I don't have this money. Can Zakah help me? Or you take the case. You have a team of doctors that you also work in close relation with, and,
Yes.
they verify, they consult.
Yes, we verify this case.
Yeah.
Or I have gone to Kenyatta, I've gone to this place. So we ask, we verify the cases, and then we say, okay, fine. It's an emergency case. How best do we assist this person?
Yes.
Do this, and this. So immediately we work on that. Some cases, we also give a go-ahead to the hospital. This emergency case, go ahead, treat this person. We'll sort it out tomorrow, the day after, but it's an emergency case, deal with it immediately. So alhamdulillah, some of these facilities, they trust. They know that when we say we will assist, they say, take it. Yeah. So we work closely with these hospitals, and they really help us in dealing with emergency cases, alhamdulillah.
So, Barakallah Fik Ali. So we've seen with Zakah Kenya, medical cases do come to Zakah Kenya. And we know the cost of medicals in the hospitals when you're going for admissions and things like that. And as Ali has said, in the public hospital, this is the way people who are much more poor and they are more deserving of the zakah, who are the ones who go there and find out if they can get the assistance there. And the assistance by Zakah Kenya there is higher. And they have also a system where they consult with local doctors to find out really, is this case worth this amount that is requesting? And those doctors themselves send them to other facilities where they can get even waived the fees. And this is a good cooperation between Zakah Kenya and the Muslim doctors. And this is how well your Zakah money is being utilized when you send it to Zakah Kenya. So Barakallahu Feek. And we will find out next about the education program.